So we're at the SARC then, the Sexual Assault Referral Centre. And this is very much an independent unit, but obviously works very closely with North Yorkshire Police. Could you just explain a bit how it kind of integrates and works with investigations and officers and reporting?
Yeah, absolutely. So this is the Sexual Assault Referral Centre, and it provides sort of a threefold facility really. So it is a medical assessment facility for victims of sexual offences, sexual assault, and then it provides a facility for forensic examination to capture evidence, and then furthermore it has a video recording suite. So obviously we would try and capture best evidence from victims of such offences, so we would interview them. So to have this facility with everything in one place in a discrete location that's unmarked is trying to be part of Oxiteria, which you may have heard of, which is obviously our transformation plan across policing and criminal justice to try and make the victim's journey, the victim's experience following sexual offences a better one, a more comfortable one, more dignified, and to achieve that best evidence to then get to justice outcomes at the end. So there are lots of technical issues around the collection of forensic evidence and accreditations that we must meet to ensure that we get through court and we get those successful justice outcomes. This facility provides that, but it also helps us to work with our partners in health and crisis support for victims at the time of absolute crisis in their life, to give them the very best care, support and that evidence capture that we can, all in one place, in one process. And hopefully that will encourage victims of sexual offences to come forward, to feel confident that we, with our partners, will do the very best that we can for them in terms of care, evidence capture and justice outcomes.
And when you look at the from a process point of view, then if someone picks up the phone with and calls the police to make a report, what happens from there?
So if people report to the police, because of course people can self-refer to this facility as well and not and decide for themselves whether they want to report that to the police. So that's a really important part of this facility. But if people contact the police to report a sexual offence, we will obviously send an officer. We have specially trained sexual offences officers who can provide that additional expertise, additional care, who will accompany a victim and stay with them. And then we have obviously crisis workers, specialised nurses and examination facilities here to just try to, as I say, make that care at this time of absolute crisis when somebody's experienced a sexual offence the most smooth, the most dignified and the very best that we can.
And with that way of working, do they generally have an assigned officer then that takes them through through that journey, if you like?
So we have sexual offences specific trained officers, so rather than trying to cut down the number of officers that a victim has to tell their account to, so we have special officers that we would try to send at the outset who will accompany them here to this facility and throughout, and then obviously we're joined by our partners in healthcare with specialised nurses and crisis workers who would then accompany them. Obviously we then have specialist investigators, detectives who would take on that criminal investigation part, who will then accompany a victim as what we might refer to as an officer in the case that people might be familiar with. So there will be a number of individuals, but we try to minimise that, and we obviously try to give them those specially trained officers to again achieve that best evidence, that best justice outcome and the very best care for victims.